Hello and good day, everyone. You are tuning in to the Undeniable Podcast, an ambitious foray into the exciting, yet not often enough explored world of excellence in the Virgin Islands. I am Shea Alexander, the host of this series of exciting conversations, and I'm the founder and principal consultant of OAC Group, a multidisciplinary consulting firm offering strategic growth and business development solutions. Undeniable has been curated for those keen to learn from individuals at the height of their career. Together, we'll enjoy frank discourse and unpack what it means and takes to be great, undeniably. Undeniable leans on OAC Group's extensive network of clients, partners, and friends to feature an impressive roster of industry leaders and brilliant minds in riveted, unscripted conversations monthly. So today we have one of those brilliant minds sitting here with us, and that is Dr. Virginia Rubaine. You've all seen the ads, I'm sure, if you're tuning in with us today. Dr. Rubaine is somebody who I have a lot of familiarity with. I've known her in a few different capacities over the years. So today I think our conversation will probably dance in between several of those capacities, making for a very interesting dialogue. Um, Dr. Ben, this is the first episode, so I'm kind of wondering if I want to do your introduction, I'll let you introduce yourself. But I think I'm going to have you go, and then I'll try to fill in the blanks with the things you may have chosen not to say that I think I know about you. Does that make sense?
Makes perfect sense.
Okay.
So my name is Virginia Rubaine. I am a daughter of the soil. I have spent my life in the pursuit of knowledge and wisdom with the intent of using it to help my people. So I am a clinical psychologist by training, and I am the director of mental health services at the BVIHSA. I have been at the BVIHSA. This is my 22nd year in the service. I'm quite proud of that. And I am very much vested in the growth and the development of this territory. Prior to this, I was an adjunct professor at the Reykjavík Community College, and I very much enjoyed my time there because it gave me the opportunity to develop relationships with our future leaders that I continue to maintain today. So I'm very honored to be the first guest of this podcast. I think it's going to be a dynamic series, and I look forward to what all our thought leaders have to say.
Fabulous. So I think the one thing that I want to get into that you did not do just now, and I mean, being a doctor is still one of those things that we kind of hold a bit higher than everything else. And rightfully so, because you guys keep us healthy and or sane, or at least you try to, in the case of some folks. Can you tell us how exactly you went from Virginia Rubaine, the daughter of the soil, to Virginia Rubaine, or Dr. Virginia Rubaine? What was that like, kind of moving from being a Virgin Islander, a very small community? I'm sure at the time there were not many professionals, particularly in mental health, but even in medicine in general. What was your career path that led to being the director of mental health services?
Well, I think it's important to acknowledge that I come from a family of servants.
Okay.
Well, servants and civil servants. So my great grandmother was known in the first district for her service to the community. So that's the foundation on which I began my journey. And so my uncle, Lavity Stout, was the first chief minister, and I saw all the wonderful changes he was effecting through his leadership. Really, my whole journey with psychology began in high school when I had the opportunity to take it as an elective, and I understood in that moment that I uniquely understood the psyche.
Mm-hmm.
And so when I was applying for university, I decided I was going to major in psychology. But it's interesting because when I left to go to university, I was determined to become a lawyer.
Okay.
There's
As
a
were most people.
Yes,
Yeah.
but there's a lot of similarities between lawyers and psychologists because we all use psychology and psychological methods to effect the change that we're trying to bring about. And so as I went through my degree program, I was like, no, this is what I really want to do. So I had an option. I could either go back to the US Virgin Islands, where I originated from, or I could come to the BVI. And I made the decision to come to the BVI. One, because they invested in me becoming a psychologist, but two, they hadn't had an established mental health system.
Okay.
So I was interested in developing a system that would be self-sustaining through the ages.
Okay. Now, one of the things that I'm really glad that you touched on it, because as I mentioned, and podcast listeners, I just want you to be aware again, Dr. Rubaine and I know each other. In fact, most of the guests I'm going to be bringing on are people with whom I'm quite familiar. So there may be some questions that I might throw in that seem like, well, where's that coming from? And it's just because I know the person in question. So you mentioned Honorable Lavity Stout, who was your great uncle, and this is something that in conversation you bring up quite a bit. And I'm really glad that you did that, because I think it carries me back in introducing this podcast, because this is, of course, the inaugural episode, the premiere episode, to why it is that I wanted to do this. How important was it for you as a young Black Caribbean person having somebody who was also Black and Caribbean to whom you could relate, particularly, of course, because in your case, this was somebody in your family, but just generally having somebody who embodied excellence or exceptionalism or greatness, and being able to say, if he can do that, I can similarly do that, or this other thing that I want to do, in your case, psychology.
Well, we have a motto in the Stout family, and it goes like this: if you can't do it proper, don't do it at all.
Mm-hmm.
And so he really reinforced that standard.
Mm-hmm.
If I was going to follow behind him,
Mm-hmm.
I had to rise to his level. And so having him as a role model really established that standard of excellence, but it also established that regardless of your circumstances, if you have a heart committed to serving your people, the opportunity will be there for you to serve.
Yeah.
Because he wasn't a formally educated man,
Mm-hmm.
but you wouldn't know that from the passion, the dedication, and the consistency in which he pursued better for his people.
Yeah.
So that was my inspiration there.
Yeah. So I think a big thing that stands out of what you just said was, one, of course, you spoke about the specific things that he instilled, but I think more generally, the fact that he served as an example, and the fact that he was not formally educated, but he was able to manage these things. Now, one of the things that you have said to me, and you have said it to me, and then I in turn have said it to a lot of people, and this is sort of jumping ahead in the conversation, but we will get back on track. But I really just wanted to touch on this really early on. Talk to me about coming back from doing your studies to a space that was essentially quite, well, I don't want to say we were backwards, but I guess we were, well, and as was appropriate based on where we were developmentally, because you don't expect a 2-year-old to drive a car,
Exactly.
right? So we were very new sort of territory, country, nation, whatever word is politically correct, and you were coming back into an environment in which I think health in general probably wasn't very thought about, much less mental health, which is a lot more abstract. What was that like, developing that, and what was the decision for you to stay in what was probably a difficult environment because it's new, as opposed to maybe traversing the US and becoming a famed, renowned psychologist? Why did you decide to stay here?
Okay, so this is a little complex. So when I left in August of '94 to go to university, and I landed on the US mainland, I had to face some really hard truths. First of all, America is not this utopia of abundant opportunities and kumbaya. It is actually an extremely difficult place to live. And growing up in the Caribbean, where you're surrounded by people that look like you, that reflect your interests, and you don't have to deal with inherent differences that you have no control over. It's just a completely different psychological experience. And so I went to America, realized I was a second-class citizen, and I had a very real conversation with myself. Do I want to fight a system that is entrenched and very much supported by the policies and the legislations that govern that territory, or would I prefer to go back and make my own Wakanda? At that time, Wakanda wasn't a word. But that was my thought process. And so I would rather, I said to myself, and I had to be about 17 years old, I would rather be a first-class citizen in a place that is my own, that my investments will benefit me and my people, than to give my best to a country that doesn't value me because of whatever perceived differences and hang-ups they have. Ain't nobody got time for that.
Yeah. And I think when we've spoken about this before, I think the consensus that we've had between us is the newness of the Virgin Islands also brings with that a lot of opportunity.
Absolutely.
Because, there are a lot of things you can do in the BVI that are almost, for lack of a better word, relatively simple, that are in fact revolutionary, because it's a developing place. So we haven't thought about it before or doing it like that before. Whereas in, let's say, a country like the US that has 10 million people for every 10,000? I'm not good at maths, and I'll admit that to my listeners right now. But they have exponentially a much, much, much larger population, much larger land mass, and most critically, a much larger economy and market. So anything that you're going to do, particularly as a business person, is going to have been done already 10 times, 20 times, 100 times. So you...
But it also, as a person of color...
Yeah.
You also have handicaps embedded in the system.
Yeah.
That even if you come up with a novel and new product or service, by virtue of your blackness, your journey is going to be 1 billion times harder.
More difficult.
Yeah.
So you came home to the relative ease and newness of the British Virgin Islands, and we're going to jump past your historicity into kind of making mental health what it is, and go to your most recent success. I'm really proud to say that I was in some ways involved in the Mindful campaign, which took you, it took your team, I think I can say, across the world. So talk to us about some of your recent happenings as it related to mental health and the campaign specifically.
So the campaign has gotten internationally recognized. And I know a lot of people often ask, what is the practicality of international recognition? Well, international recognition is the door to other opportunities.
Of course.
To include funding, expertise, and evolution. And so when international communities recognize that you're doing work that is groundbreaking, revolutionary, and they say, hey, this territory is over there doing stuff that we didn't expect from that. Based on whatever pejorative labels they've given us, like third world and etc. It is significant because what it signals to the world is we have the capacity, we have the expertise, and they can be a part of growing whatever is happening there. Or certainly partner with the process, right? So for us...
And I don't want to cut you off, but I think one of the most exciting things about it, they can also learn from what we're doing. So in a very interesting way, who would have oftentimes been at the back now gets to be at the front.
And that's what stood out to me.
Yeah.
That is what stood out to me with these two international conferences. The Virgin Islands was in the front saying, this is what we did, and this is what worked, and maybe you can do it too.
Yeah.
And saying it to supposedly first world, and people can't see my air quotes, but supposedly first world countries that are supposed to be on the cutting edge and pioneering and teaching us
and have much more resources.
And that's the thing that stood out to me. These people have 1 billion more resources than we do, but competitively, we were there next to and above them, and that was exciting for me.
Yeah. So if I recall, you sent team members to CAFA, which is the Caribbean Public Health Agency Conference. So I think we were in a bit of a smaller role there. You had the opportunity to present. And that presentation was meant to be more of like a research type presentation on what went into the campaign, etc. I don't know if you want to just quickly jump into the St. Lucia opportunity and what that looked like and what your team reported coming out of that. But I think the exciting thing for me is Iceland. So we can get through St. Lucia relatively quickly, and then we can move on to Reykjavík. I hope I pronounced it correctly.
Well, I thought Carfa was more exciting, and I'll tell you why. So it's our regional body, the Caribbean Research Health Agency, that hosts this yearly conference, and this year was its 68th year.
Okay.
So it's been almost 70 years of the best and brightest in the Caribbean gathering to present data that will be helpful to each other. And I am really interested and in support of the Caribbean pooling their resources and supporting each other.
Yes.
So CAFA was a big deal because for a lot of small island communities like us, a lot of the data coming up from other jurisdictions is daunting and sometimes irrelevant because those populations, they don't reflect our population.
Yes.
So CARFA was very exciting because they invited us. We were atypical in our presentation of the information, but they felt that the work that had been done was so significant that it should be presented to all the other Caribbean nations. And the feedback that I got is that when we did present, there was a lot of feedback from the researchers and the scientists and the doctors and the permanent secretaries and the ministers of health that attended. Wait. The Virgin Islands did this, so I mean, we could do something like this too. Let's talk, let's partner with each other. And that's what I'm talking about. These types of international opportunities generate opportunities that wouldn't otherwise have been present.
Yeah.
So CAFA was really exciting from that perspective. And, BVI is right now in discussions to possibly host the 69th conference here. And I'd be super honored and excited if we were given that opportunity. So it was very exciting because when I started this campaign, when I was interviewing for our slot, one of the things that I said that was my goal, and it still remains my goal, is taking this anti-stigma campaign throughout the Caribbean.
Yeah.
And for practical reasons, we have a lot of our Caribbean brothers and sisters coming here to live and work, bringing whatever attitudes and beliefs they have from their countries of origin. So in my mind, if all the Caribbean countries are working as a collective to eradicate stigma and discrimination, then when persons come here, they're quite comfortable with having modern conceptualizations of mental health and wellness.
Yeah. And while we're still on the sort of regional successes that you achieved, I think it's also worth pointing out that you were invited to present at the OACS Minister of Health meeting that was held actually right here in the British Virgin Islands. And if I recall, because I happened to have the privilege of attending that with you, you had very similar reports of, high engagement, a lot of interest in how you were able to do that, how you were able to manage that. And we'll circle back to this, but I think it's extremely impressive when you consider the resource base or lack thereof from which you kind of launched this campaign. And I'm deliberately kind of teasing certain things and I'm coming back to them, so it stresses the need to keep listening. But now let's talk about Iceland, because regardless of what you say, I still maintain Iceland for me was incredibly exciting. Anytime you take a cross-Atlantic flight, to me that's exciting. So you ventured over to Iceland. You actually had to go by yourself, but I think you were joined by Sue Baker, which was the British consultant who acted sort of as a coordinator and support for the campaigns between ourselves and Bermuda.
Correct.
And talk to me about that experience, because it seemed to have been very, very exciting. And it certainly wasn't one that is commonplace for us here in the British Virgin Islands.
It was super exciting. So it was the World Psychiatric Association's annual stigma conference, and it was held at the University of Iceland in Reykjavík.
Okay.
And essentially, it pulled all the thought leaders and doers in stigma and discrimination from across the globe. The Virgin Islands was selected to chair one of the symposiums, so that was an honor. We were also asked to present jointly with Bermuda on the campaigns, what worked, what didn't. But the biggest honor of all was being asked to be a part of the plenary.
Yeah.
And so the plenary is where everybody comes together to hear what is happening, what is relevant, what is new.
Yeah.
And not only did we have maybe 70, 80 countries in the room, but we also had a worldwide virtual platform.
Yeah.
And so people were logging in
Mhm.
virtually from all across the world. And, I shared with you, Shay, I didn't understand the magnitude of the plenary until I got at the venue, saw the participating countries, and realized that the Virgin Islands, this tiny dot in the Caribbean Sea, was sitting with Austria, Australia, Ireland, the United Kingdom, that we were on par, if not better, than these countries in terms of these campaigns. And so it was like a real awestruck moment for me, because when I'm doing my work, I'm just doing my work to the best of my ability.
Mhm.
And I'm so focused on improving life for the residents of this territory that sometimes I miss out on the grandeur, right?
Yeah.
Because you sometimes you're fixated on the day-to-day operational practicalities. We don't have any money. We don't have any resources. We have to
Mhm.
figure this out. And so it wasn't until I sat on that stage that I really understood the magnitude of what we had achieved.
Yeah. Well, I had shared with you when you told me you were there, and Australia was, I think, one of your, well, not co-presenters, but they also were one of the, because essentially, and for those of you who are not perhaps familiar with attending conferences or the constitution of a conference, most conferences have what people sort of call like breakout sessions. So, for example, if it's hosted at like a university, you'll have breakout sessions where specific niche topics are discussed in like a classroom. So you might have 10 to maybe 50 people in the rooms talking about the collapse of FTX, or, Nordstrom's success in 2016, something like that. The plenary is when everybody is in the auditorium and we're all tuned into these singular, what I would call headlining speakers.
Mm-hmm.
So it is essentially the feature presentations of the conference.
Correct.
So you were one of four, if I recall, there were four during the
Yes.
entire conference. So it was a huge deal. But it was very exciting for me when you said to me that Australia was one of the headliners. Because for those of you perhaps not so familiar with the mental health space, Australia is seen as a global leader in mental health,
Absolutely.
as similar to their very close cousin New Zealand.
Correct.
If people might recall, and we even actually posted of this in the context of the Mindful campaign, Jacinda Ardern, the former Prime Minister of New Zealand, resigned for mental health reasons.
Mm-hmm.
And I think that speaks to how forward thinking they are and how aware they are of mental health and how comfortable they are with the idea of good mental health. So I just found the entire thing to be really, 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 I mean, exciting is a word we probably overused. But there's no better word to describe the feeling. And I
It
think
was awe-inspiring.
yeah.
Yeah.
And I think that is really what I would like to get at with this podcast series, with these conversations, because I use in the introduction and in the description of this podcast, I use the word unexpected, because I think very often we don't understand within the very small context of the British Virgin Islands, a lot of big things happen.
Mm-hmm.
I mean, and I'm not gonna talk about them right now, but some of the people that I have lined up to speak in different spaces, financial services, philanthropy, education, are similarly doing things that are setting tone and setting trends at a regional and international level.
Well, that's why it's so important to travel, because
Yes.
at the conference in Iceland, I was gobsmacked to discover that even these big countries, the UK, Australia, Kenya was there, they've all lost their funding.
Mm-hmm.
And funding is an issue straight across the board. And even though the World Health Organization has said to us that we're losing billions and billions of dollars, maybe even in the trillions if you look at it collectively, to mental health related illnesses and the lack of productivity associated with that,
Mm-hmm.
you still cannot convince countries that this is something that has to be consistently funded.
Yeah. Yeah.
So to hear the UK strategizing that the government has changed now,
Mm-hmm.
and the Labour Party has always been very sympathetic to health related causes,
Mm-hmm.
and so here's an opportunity for them to get funding again. I was like, well, yeah, it kind of normalized my experience. But the other thing that is important for our people, we don't know how good we have it here.
Mm-hmm.
And until you travel someplace else and you recognize, like, for example, our community health model is probably superior to anything else in the Caribbean.
Mm-hmm.
I can tell you unequivocally, America doesn't have a community health model.
Mm-hmm.
And so if you don't have insurance and you can't access a provider, you're not going to get care.
Yeah.
You know, our mental health, and not because I'm the director, but when I travel to other Caribbean countries, and if some of our guests and resident guests would be honest, their systems are extremely primitive.
Yeah.
And we have a very modern system, both publicly and privately, that gives people access that they didn't have when I came here 22 years ago.
Yeah. So, well, Dr. Ben, I'm glad that you are willing to say things like this because I I think sometimes culturally the pendulum swings too far in one direction, right? So I think there was a time when being sophisticated meant being very braggadocious, right? And you had to and it kind of has evolved even in the taste of the elite. So we went from maximalist tendencies to now Kim Kardashian has a house that has like nothing in it because we've swung the other way. But I've been a bit disturbed because, and it swings back to the reason I'm doing things like this, conversations like this. We've now gotten to the point where I think people feel you must never be boastful or you must never be proud. So to hear you categorically talk about the success that we've achieved at a national level, I like that because you don't hear that happening often enough. But there's a quote.
False humility.
Yeah, and it has no place anywhere, right?
No.
But there's a quote from Nicki Minaj. She says, "I have the biggest impact. Check the spreadsheets," right? So it could be fact checked. People can go and Google it if they want. They can look at the mental health care in other jurisdictions and see if it compares, right? But to move on, I just want to make sure people understand what we're talking about. So you went to Iceland, you went to CAFA, you went to OACS, and you achieved other successes. This was all off of something called the Mindful Campaign. And you spoke a little about at the ending of what you just said about the idea of funding and the difficulty worldwide in finding funding for mental health. Now, where I was first impressed with your efforts was the fact that something that you don't see happening often enough in the BVI is what I call public-private partnership. Well, I shouldn't say what I call, that's the name for it. But, you were able to get funds from Unite BVI and separately from Hanny's for a very specific part of the campaign, which was a scholarship. What was that process like, and why did you end up even looking in that direction to get that sort of partnership to move forward?
Well, I knew there was not going to be any financial support coming from financial support, I should say, coming from HSA or the ministry. I'm sorry if somebody gets upset, but that's the truth. And I absolutely wanted this campaign to come to fruition because when I joined the service in 2003, and I recognized how deeply entrenched the stigma and the discrimination was. I always famously tell the story. PSDP was having their health fair, and they invited everybody except mental health. And I'm the new kid on the block. I don't know how deep this stigma goes. And I call over to the civil service HR, and I said, "Hi, I'm Dr. Rubaine. I'm the new psychologist. I realized I haven't a health fair, and everybody else has gotten invitations, but we haven't gotten ours." And she says, "That's because we didn't send you one."
Okay.
And I said, "Why?" And she said, "Because you're mental health. You're crazy people."
Yeah.
And so that's when it went ding, ding, ding in my head that if I was going to establish a system and make it fashionable to be mentally well, that I would have to tackle the stigma and discrimination. And I recognized the way to do that was by outreaching to the community. And so I began with May is Mental Health Week. Then I evolved into May is Mental Health Month. And when I became the director, I won't say it's the first family fun day the Virgin Islands ever had, but it was certainly the first fun day that I had seen since I had been living here on that scale, where we had our version of Family Feud, and we had created a lot of private-public partnerships. VA Motors had donated a car to the winning family, and it was just fabulous. And out of that was the genesis of the Incredible Race.
Mm-hmm.
And we ran the Incredible Race for years, and we started doing targeted activities for World Mental Health Day in October. And the more we had these fun-filled activities, the more engagement we started getting from the community. I tell my team all the time I've paid my dues. That the first 5 to 10 years of my tenure here was spent on the radio and on TV, late night TV, on the radio, on various talk shows, really talking to the community and normalizing for them that mental health providers are attractive, we're articulate, we're smart, we're natives. There's nothing to be afraid of, right? And that's when I discovered that the stigma really wasn't about mental health itself or mental disorders or mental wellness. That's when I discovered the stigma really surrounded people seeking help. We don't have a problem with acknowledging that people are not well. We get very uncomfortable when people seek help for their unwellness. And that is what I have been battling for the past 22 years.
So you took the package of attractive, articulate, smart, and native, and you went to NECA.
Yes.
And you petitioned, and what was that like?
So Unite BVI invited us to come and present our cause, this campaign. And it should be noted that Virgin Unite, who is the bigger arm of the charity, had ratified this campaign in the UK. They were one of the first supporters of the campaign. So Unite BVI was very eager to partner with us, and they invited me over to NECA. And it was fabulous because I had a treasure trove of images and videos of things that I had been doing over the years. So I wasn't some Johnny come lately who now want to have a campaign. I had been campaigning, but not at the national level. And so what their funding would do is give me the wherewithal to campaign at the national level, where I could pull in the deputy governor and I could pull in, really big personalities into the campaign. And so it was a really wonderful experience, and they've had me over several times. To interface with their guests and to really say this is a worthwhile endeavor. So it's been great.
Yeah. So as we think about the nature of success and being pioneering, I just want to point out here as a sort of aside, one of the things that you just mentioned that I think is so important, particularly for younger people to think about, is the idea that success is a ladder.
Yes.
And every rung of the success that you achieve is very much a feature of the rungs that you've passed. So I think you mentioned just now, and this is even just sort of like marketing and business development 101, you had done this groundwork, this grunt work of doing all of these radio shows, interviews, etc. So by the time you made it over to NECA, which you could consider almost like one of the highest opportunities you could get for funding, because it's, as they call it, the billionaire belt. That's like the capital of the billionaire belt. So it's one of the best opportunities you could probably get for private funding. You make it over to NECA to make a presentation, and you were bolstered and supported and augmented by this history of work that you had done. And I really would like for young people in particular to learn from that as an example, because too often we feel, I think sometimes we get a little bit too audacious, and we believe that we should just be bold and enter the space and make a demand. But there is nothing better than what I like to call proof of work, proof of concept behind you, or even just proof of effort to support the fact that I've been doing this and I will continue to do this. I'm not a Johnny come lately, as you mentioned, and there's past success and there's going to be future success. Hello everyone, this is Shay, and you have been listening to the Undeniable Podcast, Episode 1. Now, of course, I'm sure you can tell that I'm coming to you at a slightly different time, but with the same good intentions. I'm so grateful that you guys have made it this far into Episode 1 of the Undeniable Podcast, and I'm hoping that you've been enjoying this really riveting conversation with Dr. Rubaine as much as I had when I actually recorded Episode 1. As you can tell, this is a bit of an abrupt interjection, and I do apologize for that. But the Undeniable Podcast is really meant to serve as easy listening. So something you can play in the background when you cook or clean or maybe work on a project that doesn't require all of your concentration. The conversation has been going extremely well, but it's also taking quite a bit of time because we cover a lot of ground. And we had actually come to what felt like an organic stop point where we transitioned from talking about the history of Dr. Rubaine's success in pioneering the mental health space in the British Virgin Islands and started talking about the philosophical framework that drove that success and facilitated that success. So I think it makes sense for us to now divide this into two parts. The second of which, like I said, is going to talk more about the mindset and resources that allowed her to be so successful. And I hope that that can be inspiring to my listeners, and I hope that it encourages you to keep listening to the Undeniable podcast as I continue to bring to you fabulous guests, excellent ideas, and just powerful, powerful motivation. So I look forward to joining you soon, and thank you so much again.